And our next speaker is Dr. John Foreyt, who's been a good friend and colleague for decades. He's at the Baylor College of Medicine in Houston, and we have a worldwide competition who goes to Les Mis the most. So,
that's right. Thank you, Steve. And John, that was excellent, but I guess you didn't get the message. It's red tie day, so sorry. Yeah, you didn't get the memo. My message this morning is, 2/3 of us are overweight or obese, so we need all the help we can get. And one practical solution, or at least help, would be low-calorie sweeteners, because low-calorie sweeteners offer a very inexpensive, safe, practical intervention for reducing calories. There you are. So that may help lower weight. It may help manage diabetes. So let's take a look at that. There are more than 350 million people in the world with diabetes, primarily type 2. So 350 million. So it's more than doubled. Prevalence has doubled in the last 30 years. It keeps going up, 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 all over the world, not just here, but all over the place. That's been predicted by 2030. We're going to have more than 500 million people. And think of the expense and it's a horrible disease. So we need good strategies to prevent and certainly to manage. There are many drivers to diabetes. I mean, there are many causes, multifactorial, but certainly one of them, as we get heavier and heavier, is a major association. So the association with BMI, and Nurses' Health Trial, for example, says that women will start increasing the prevalence of increasing risk for diabetes with a BMI of 22 already, which is that normal. Normal range is 18.5 to 25. So at 22, and I just pulled this up with Jim's help, 5'4" woman, 5'4", who weighs 129 pounds, 5'4", 129, is a BMI of 22. Joanne Manson's Nurses' Health Trial, showing that's already increasing risk. The Boston study with physicians and healthcare professionals, showing a man 5'10", 160 pounds, 5'10", 160 pounds, is a BMI of 23. That's already risk for diabetes. So, I mean, that's scary. So what can we do about this business? Well, small changes in diet, small changes in physical activity can help reduce weight, and there are plenty of studies to show that. So we can go through all of them if you want to, but I'll just give you an example or two. The Diabetes Prevention Program showed a 58% reduction in the incidence of new cases of type 2 diabetes with lifestyle intervention versus placebo. And what they did was, those of you, I think most of you probably know the Diabetes Prevention Program, but they recruited and randomized more than 3,200 people who were at risk for diabetes in this country. They didn't have diabetes, but they had at risk for it. Then they randomized them into 3 groups. One group got a placebo pill, all double-blind. Another group got metformin, which is one of those first-line treatment interventions for diabetes. And one group just got lifestyle, diet and exercise, with behavior modification. And that diet and exercise, the intensive lifestyle group, the goal was a 7% loss of weight, 15, 16 pounds, so 7% weight loss, and walking 30 minutes a day, 5 days a week. So 150 minutes of exercise, primarily walking, and lowering the weight by cutting calories for just 7%. I mean, people can lose 7%. Anyway, the results showed that there was a dramatic decrease, a minus 58% decrease in the incidence of new cases of type 2 diabetes with just lifestyle compared to placebo. 58%, I mean, that's just unimaginable to me. I mean, it's incredible what small changes in lifestyle can really do for people who are at risk. There was a 31% decrease comparing it to metformin, but lifestyle clearly is the winner. I mean, the way to go with this whole business is diet and exercise, and small changes. You don't have to lose 50 pounds to be healthy. You need to lose 5%. The other study I want to just review with you quickly is our study. Jim is a PI on it in Denver. I'm a PI in Houston of Look Ahead. We just published the 10-year data in the New England Journal the end of August. So pull that up when you get a chance if you haven't seen it. But I just want to show you the relationship to diabetes. Look ahead, we recruited and randomized 5,000 plus adults with type 2 diabetes. They're also heavy, so they were overweight or obese, and also had diabetes. And when we looked at what is the effect of small changes, and the goal again is same as DPP, Diabetes Prevention Program, 7% weight loss, and then the exercise was a little bit more, 35 minutes of walking a day, 5 days a week, which is 175 minutes of walking, along with behavioral changes. And what we found with respect to diabetes, all of these people, remember, have diabetes, but what we showed over the first 4 years of the trial, which was published in JAMA, partial or complete remission of diabetes in 11.5% of patients receiving intervention. And again, this is just a weight loss study. We're interested in weight loss with respect to cardiovascular outcomes. That's our primary outcome. But when you're looking at, can you also reverse diabetes? Yeah, not in everybody, no. But I mean, it's just remarkable what small changes can do. So low-calorie sweeteners then. You want to cut 100 calories, 140 calories a day? You can do it with low-calorie sweeteners. It's common sense. They're safe, they're practical, they're inexpensive. The American Heart Association, American Diabetes Association, the Academy of Nutrition and Dietetics, they all conclude extensive reviews of the literature, extensive randomized controlled trials, et cetera, low-calorie sweeteners can help you reduce caloric intake and help maintaining healthy weight. I mean, that's the bottom line. There's 0 calories with diabetics. It can help control carbohydrate, obviously. They don't have any calories, or essentially negligible calories. So they're safe, they're inexpensive, they're small changes. They can serve an important role in diabetes prevention, diabetes management. It makes sense. I mean, it's just a common sense approach, and there are plenty of studies to show that when you incorporate low-calorie sweeteners into a diet, in a randomized controlled diet, you can show weight loss. They don't increase appetite. They don't increase all these things you read about on the internet. They don't increase overcompensation. They don't just go through the whole list of these things. Well, if you look at the randomized trials, they don't. They're 0 calories. They don't affect glucose because they don't have any calories. So bottom line, engaging in a healthy lifestyle is central to the prevention and management of diabetes. So one approach, again, this morning we're looking at these inexpensive practical strategies. Low-calorie sweeteners can help reduce caloric intake. It's a simple strategy to do it. Low-calorie sweeteners provide flexibility. They provide health goals. You can read the little article that we did on it, but there's plenty of others if you look at the randomized trials. Bottom line, if you want to help manage weight, both in diabetics and in all of us, low-calorie sweeteners would be one way to go. So, thank you.
Thank you very much, John. While I'm pulling up the next, I want to make just one additional comment. My colleagues all know I can't keep my mouth shut too long, but in the DPP, the famous study that showed the great effect of lifestyle, a lot of my clinician friends said, yeah, but it's too complicated. They have to come in and talk to dietitians and exercise counselors and so on, and it costs so much. And then DPP published the cost effectiveness analysis. So the metformin cost twice as much and was about half as effective. Lifestyle changes are good for you.
Thank you.